This is part 2 of chapter 6 on communicable diseases in children. Here's a baby with some chicken pox, which is varicella. The pox start out as a fluid-filled bump, a vesicle, and that one looks pretty fluid-filled still. Maybe this one, it's hard to say. This one may be a little bit, but this is very typical. The rash breaks out in these fluid-filled vesicles, which then over a few days will dry up. It tends to break out in waves for a few days and then takes a few more days to dry up. So it's about a week of being contagious. Once all of these vesicles are scabbed over like these, they're not contagious anymore. So the child doesn't have to be totally free of spots. The spots have to all be scabbed over. One of the problems with chickenpox is it's on average 14 days from exposure till you break out. It can be as much as 21 days. So it's very easy to be exposed, think you didn't get it, and then you break out. And you're contagious for usually about 24 hours before you break out. The child will start a fever and irritability first, and then the chickenpox come. But they've been contagious during that first 24 hours, and this is airborne, right? So just walking near someone, you can pass it on. As far as immunizations go, this is probably our least effective immunization, depending on the studies you look at. 40 to 50% of kids who are immunized will still develop chickenpox, but it has just about totally eliminated severe infections. When I worked at Pete's ICU, it seemed like, not often, but a couple times a year we'd have a child admitted to the ICU with usually chickenpox pneumonia. So this had gone down into their lungs, or they'd be down on the floor, the regular acute care floor, with it so badly in their mouth that they were dehydrated because they wouldn't drink. And it's really rare to have a normal, healthy child admitted to the hospital with chickenpox anymore. So the shot has been extremely effective in preventing severe infection, but only marginally effective in preventing infection at all. Fifth disease, this is a parvo virus, not the parvo that your puppy can get, human parvo. This, the child will look sick, act sick, have a fever, and after a few days they develop this slapped cheek look. Their cheeks turn bright red, and typically this is when they'll call the pediatrician and they're able to say, oh, that was fifth disease, your child's just about over it now. By the time you get that slapped cheek, you're towards the end of it. It's usually not a very severe infection in children. The problem is if a pregnant woman gets it. If a woman gets an initial infection, she's not had it before, and she gets it during that first trimester of pregnancy, it's very damaging to the fetus. Roseola, this is often called infantile measles or the 3-day measles. This is not a very severe infection, and it's almost always in infancy because once you've had it, you won't get it again. So it tends to go around in infants. They'll have a high fever for 3 days, after which they break out in a rash. Again, they're contagious during that beginning part, and then we can finally say exactly what it is when we see the rash. So this is characteristic rash of that. So this, even though we call it infantile measles or 3-day measles, this is not the measles in the measles, mumps, rubella shot. This is the not severe measles. Mumps is in that MMR shot. Mumps is swelling of the parotid gland, which is one of your salivary glands right here in the neck. It's obviously whenever you have swelling around the neck, you're going to worry about airway, but one of the big issues with it is catching it older, like the boy in this picture. It can easily travel to the testes and cause sterility. So that's one of the problems with it. Now here's our real measles, Rubeola. This is the one in that measles, mumps, rubella shot. And it has, again, a characteristic rash. It's just much denser of a rash than most of the other rashes. Measles is a horrible illness. Even properly treated, there's a lot of death with measles, and even properly treated, many children will end up hospitalized with it. So it is a bad illness. This is the one that spread at Disneyland a year or two ago, where somebody who wasn't immunized, who was in the early stages, so they weren't feeling well, but it didn't have the rash yet, but they were contagious, went, and so all the kids who were there who are not immunized were able to catch it, because this floats in the air. This is one of those very small particles that doesn't just go out a few feet and drop, where we put you on droplet precaution. This is your true respiratory precautions, where it can float a long ways. All you have to do is walk by somebody and you're likely to catch it if you've not been immunized against it. And all of these, as I said, they have a rather long incubation period. So here's pertussis. You may want to watch this. Is a picture of him coughing. Should be a link to the YouTube. Pertussis, the younger a child gets pertussis, the higher the risk of death, of mortality. Children who are not fully immunized, which means less than 6 months, because you get those shots at 2, 4, and 6 months, have a relatively high mortality rate, and especially under 2 months. It's not a shot we can give less than that, because the risks of the shot become higher, but catching it at that age, it's got a very high mortality rate. We used to not give this past infancy. You get a booster at starting school, but then we didn't give any boosters after that, because you don't get that sick with it later. You get a bad cough, a bad cold. It seems to take a long time to go away because it's a bacteria. I think this is the first one we've had on our list that's bacterial. So we do give an antibiotic if we diagnose it, but your body can kill bacteria. It just takes a long time. And so older, you'll just think you have this cold that's lingering with a bad cough. The problem is you then can give it to an infant. So we're now really trying to get everybody who's around any infants to get that DPT shot, the P being pertussis, rather than just giving them the DT, which is the tetanus and diphtheria, like we used to do. So this one's been a problem. We've been considered at an epidemic level in Fresno County for quite a few years now. Polio. When I was a kid, the polio immunization was relatively new. Prior to that, there were people who were post-polio, so they had survived it but had long-term muscle control issues and a lot of pain. So again, with immunizations in the U.S., this is not something we see often here, but you still will see it in third world or developing countries. Rubella, measles, mumps, rubella, right? So this is in that MMR shot, also called German measles. The big problem with this one is passing it on to a pregnant woman. So it's not such a terrible illness for the child. They get a rash, enlarged lymph nodes, but it's extremely bad for anyone who catches it during pregnancy. Scarlet fever. This is untreated strep throat, or for some people it just tends to not stop at the tonsils and goes systemic, but basically it's systemic strep infection. So you get this strawberry tongue and a rash. You can see kind of some of the other symptoms. We absolutely want to treat any strep infections with antibiotics. We want to make sure it's strep and not just a virus, because, right, antibiotics do nothing on a virus. But if you leave strep untreated, it can turn to scarlet fever. Scarlet fever, untreated, can settle into the kidneys and do permanent kidney damage. It can settle into the heart, most often into the mitral valve, and when that happens, it's called rheumatic fever, but it does permanent heart damage. And so now we have a kid whose heart is like an 80-year-old. Conjunctivitis. This is pink eye. In newborns, it can be something they caught passing through the birth canal, but it can also be a blocked tear duct. And so if it's infectious, obviously we need to treat it. And these are in italics, so these are the scientific name of different bacteria. But a blocked tear duct doesn't need antibiotics. It just needs warm packs to try and clear out that tear duct. Pink eye can be caused by a virus. It can be a bacteria. It can be allergic. It can be something in the eye. You get some sand or an eyelash or something in there and it gets all irritated. But little kids, when their eye is sore or itchy or bothering them, they take their dirty, grubby hands that they've been putting infected places, like down their diapers, and rub them into their eye. So typically on kids, pink eye turns bacterial. It becomes a bacterial infection regardless of how it started. And this one is bacterial, right? You've got the yellow, goopy discharge. It's not just thin and clear. And this kid probably woke up in the morning with his eye glued shut and couldn't open it. And you had to get warm water and clean off some of that drainage which had dried overnight to let him even open his eyes. So this one's going to take antibiotic eye drop and is highly contagious, right? That's just full of germs for him to rub and then touch other things for other people to catch it. Stomatitis. This is sores in the mouth, such as herpes, hand, foot, and mouth disease, which is a virus kids get, also will cause that. Or kids on chemotherapy will develop stomatitis from as a complication of the chemo. The big problem is if it hurts enough, they won't eat or drink. And so then we're worried about them getting dehydrated. And I think I have a picture here. Look how painful that is. He's not going to eat or drink anything. So we're going to have to give him some IV fluids. We do have some antiseptic rinses that also have a numbing property, numbing medication to try and numb some of that pain. And often if we do that, then they can drink at least for a little while it's not hurting as much, and then they probably will quit again drinking once the pain returns. Parasites. Most common ones, pinworms and Giardia. Giardia is a protozoa that forms a spore. This is what people get when they go up camping, because those spores, even if you boil your water, it doesn't kill it in that spore stage. So if we're thinking, if somebody's having diarrhea problems, we're going to ask about camping. Pinworms make the rectum very itchy. The worms come out at night and lay their eggs around the rectum, which then a child scratches, and then they go and eat and reinfect themselves. So the big symptom to look for on this is that itchy rectum, especially in the morning. And so how do we diagnose it? We figure out what's around the rectum first thing in the morning before they have bathed or had a bowel movement. So we do that by taking tape and in the morning putting it against their rectum and then fold it in half. So if there's eggs on there, you captured the eggs inside the tape, and bringing that into the physician's office to look at under a microscope to see if it's there. Kids often get pinworms from playing where their puppies poop. So that's a good treatment, or I mean a good teaching. And Giardia and pinworms are both pretty highly contagious because we change your diaper at daycare and then everybody else uses the same thing. So cleaning the area where any diaper changes have been done is important. These are easy to kill, by the way. couple of days